Welcome back to Loving Living Local. Good morning. It is time for another Medical Minute. We are at Colorado Springs Orthopaedic Group, and joining me this morning is Dr. Sung. Thank you so much for being here.
Thank you.
So there is a lot of talk that I'm hearing that's going on about Xvision Augmented Reality. Can you kind of tell me what that is?
Xvision is a way to see a patient's anatomy in 3 dimensions live in the operating room through a headset. It's like having X-ray vision in that we can take a peek inside. We can take complex spine anatomy and simplify it to allow for better precision and accuracy in surgery.
Wow, that's very high-tech kind of thing, so you don't really have to go in. So can you kind of tell me how that has impacted like what you do, and how has it improved the efficiency of your procedures?
It allows us to do surgery through smaller incisions or minimally invasive. It allows us to be more precise and specific, and it allows us to be faster in surgery.
That's incredible, actually, that you can do it, because usually you'd have that long scar, but this actually minimizes that and makes it a lot better for afterwards.
Absolutely.
Okay, so can this technology be used based on every patient, or are there specific criteria to be eligible to be able to use this?
Right now we're using it in spine fusion patients, but you could potentially take that technology and expand it to other areas of medicine over time.
So spine fusion is whenever you put pieces of the spine together?
Right.
Okay.
There are certain patients whose spine has become unstable or degenerated over time, and we reconstruct and realign it and fuse it so it becomes one solid segment.
Okay, and then there's other patients on top of that that might be able to benefit from this as well, you're saying?
Yes.
Okay, so how has Xvision improved the outcome for the patient?
Because we can work through smaller incisions, there's less trauma to the tissues, and with that is quicker recoveries overall. And so as we do larger, more complicated surgeries, we can be faster and more efficient.
So just to give me an idea, how long is a typical recovery time versus with this Xvision recovery time?
For recovery from spine surgery, it usually depends on a lot of factors.
Okay.
And how old a patient is, what's their overall health, and actually how many levels of the spine we're fusing. But with this technology and with the techniques we're using, we're able to do oftentimes 1 and 2 level spine surgeries as outpatients in our surgery center. So these patients often will have their surgery, spend the night, and go home the next morning.
Wow, and compared to the way that that used to be, would they have to stay and be monitored for a while?
Many years ago, patients would stay up to a week after surgery as a routine.
Really?
But as time has changed, as our techniques have gotten better, and with new technology, we are doing this routinely in the outpatient center.
And so they can come in, have the procedure done, and be home and not really even worry about it.
Correct.
Afterwards. That's incredible. Well, I think that this is amazing. Have you really enjoyed using this new technology? Has it improved your overall experience?
Absolutely. We can be that much more accurate, and with time, as you're more accurate, you can be faster, and it just helps with patient outcomes.
Wow, that's incredible. I love the new technology that they have that make it a lot easier, not just for you, but for the patients also, because that's really what you want. Less recovery time means that people are more likely to take care of the issues that they're having.
Absolutely.
Well, I really appreciate you joining me this morning to kind of give me an update on this. This is something I never heard of, so thank you very much.
Thank you.
I love that. All right, and if you need some more information on Colorado Springs Orthopaedic Group, you can go online to csog.net.
All right, thanks so much, Dee. And this segment is sponsored by the Colorado Springs Orthopaedic Group.